Today, we're going inside a year of data from the Gigeba Rural Hospital. And let me tell you, this isn't just a spreadsheet full of numbers. It's a real, boots-on-the-ground story of resilience, of crisis, and of incredible care. So let's break down what this data is really telling us.
Okay, let's start right at the hospital's front door. In 2025, they saw 14,526 outpatient visits. Think about that for a second. That's every single person who walked in looking for help, forming the daily rhythm of this hospital's work.
But you can't treat what you can't see, right? Behind every one of those visits was the lab just humming with activity. They ran 17,195 tests last year. Each one of those is a piece of the puzzle, a crucial step to figuring out what's wrong and how to fix it.
And then you see a number like this one, 44,046. That's how many life-saving immunizations were given. This is where the story shifts, because it's not just about treating sick people. It's about stopping illness before it even starts, on a massive scale. So when you put all of that together, the visits, the tests, the immunizations, you start to get a sense of the sheer scale of care we're talking about. This isn't just a building with doctors. It's the very heartbeat of this community's health.
Okay, so with that kind of scale in mind, what are the biggest battles being fought here every day? Well, the data gives us some really clear answers. It shows us exactly why all those people are walking through the hospital doors in the first place.
And that brings us to the main front line. The data is clear. This hospital is on a constant war footing, and the biggest fight day in and day out is against infectious disease.
And here's the #1 enemy. I mean, just look at that first bar on the chart. Malaria. Over 5,600 cases. It just completely dwarfs everything else, like serious respiratory infections and pneumonia. It's not even close. This is the single biggest health burden this community is dealing with.
But who is this enemy hitting the hardest? That's where the story gets really personal. The data is crystal clear. It's the most vulnerable. We're talking about children under 5 and women, who make up the huge majority of these cases. So this isn't just a disease, it's a direct threat to the next generation.
But fighting disease is really only half the story. It's not just about playing defense. The hospital is also on offense, trying to build a healthier future. And that all starts with protecting mothers and their kids.
They do this with what's called a continuum of care, and it's pretty amazing. It starts with over 2,000 checkups for expectant mothers, continues with more than 400 safe deliveries right there in the hospital, and then follows up with that massive immunization program we saw, protecting babies from day one.
Let's just pause on that immunization number for a second. To get to over 44,000 in a year, you have to vaccinate, on average, 120 children every single day. Weekends, holidays, you name it. The work just doesn't stop.
Now, the daily grind is one thing, but what a report like this can also show you are those moments of pure crisis, the moments that test a hospital's ability to handle extreme pressure when everything goes sideways. Yeah, when you start looking at the data month by month, something just jumps off the page. Right in the middle of the year, there's this huge spike. It's dramatic. Something happened that pushed this hospital and this community to the absolute breaking point. So what was it?
Here it is, a sudden, catastrophic spike in malnutrition cases. Just look at the bars for July and August. They shoot through the roof. Over 1,400 cases each month. Compare that to January, which had just 47. This wasn't a slow burn. This was a sudden, devastating crisis.
And to give you a sense of just how big this crisis was, check this out. By the end of the year, the total number of malnutrition cases was nearly 7,000. That's actually more than the total for malaria. So this was a full-blown emergency happening on top of their already biggest emergency.
And yet, here's what's really incredible. While all of this was going on, while they were managing this massive, unexpected crisis, the core of the hospital just kept running. The surgical team still performed 30 major and 162 minor surgeries. That shows an unbelievable level of resilience.
So let's zoom back out. When we look at the whole year, what is the story that this data is really telling us about Gigeba Hospital in 2025?
Well, it's really a story in 4 parts. They fought a relentless war against infectious disease. They served as an absolute pillar of strength for mothers and their children. They absorbed and responded to a shocking, unprecedented nutrition crisis, and through it all, they somehow managed to keep the lights on for critical care.
The story of 2025 is a testament to their strength, for sure, but it's also a clear warning. This data shows a team operating at its absolute peak,
fighting predictable battles while absorbing a catastrophic shock. So the real takeaway isn't just about what they accomplished. It's about what happens next. After a year like this, what does this hospital and this community need to do to prepare for 2026?